Neuropathy is described as burning, tingling, or numbness in your feet, your toes, your hands, even your fingers. Many suffer with the condition, but locally, though, patients might be able to get some much-needed relief. Dr. Zach Parker from West Texas Wellness Center is in today with Todd Quapple, one of his patients. Todd, thanks for being here. Doc, thanks for being here. Let's talk about the condition that you were facing, kind of what you were dealing with, Todd.
Well, I had severe burning and tingling pain in my feet and in my hands.
All the time?
All the time, yeah. I suffered greatly, couldn't sleep well with it, and couldn't do much of anything anymore. It was down to almost nothing.
So you sought out other doctors, I assume, and other forms of treatment, right? To no avail?
To no avail, no. I took quite a bit of medication for pain, and my option was to take more medication.
And so at a certain point, you just didn't want to take any more medicine, right?
Exactly.
Okay. And so you came to see our good friend Dr. Parker, right, over at West Texas Wellness. And kind of, Dr. Parker, take us through his treatment, what y'all are seeing.
Well, Todd came in for evaluation to make sure. One of the things we always want to see when patients have these conditions is to confirm that it is truly from neuropathy, not a radiculopathy or something of that nature. There are some spinal, and so when we did the evaluation, we found some spinal components to what was going on with his case, but also some metabolic issues that were causing the problems that he was having. So we did a thorough evaluation, determined exactly what he needed to begin to recover, and we've just been walking him through that process, and it's so far succeeding really well. I think he had it really severe in both his feet and his hands. A lot of patients will have it in their feet. It's not as usual to see it in the hands. So he had a pretty severe case of it, and it's been fun to watch his response, how much better he's doing, and
What are some of the causes that contribute to neuropathy?
Well, there's all kinds of causes. That they're going to say your number one contributor usually is diabetes. Is going to be.
I'm not diabetic.
Is that what? Okay.
Yeah, so that's the metabolic side of it. But we also see many times there's other things that are associated with it. Sometimes chemotherapy can cause it. Compression of nerve roots for an extended period of time can also damage the nerve, so that contributes to it. So we usually will see a combination of multi-factors. Everybody wants to just say, oh, it must just be the diabetes. We can clean up the diabetes and they can still have problems if we don't address some of the other nerve root issues. And so that's one of the things we just try to make sure and look at all the possible contributors and clean that up.
And so maybe that's why you're being able to, or you're seeing success where other doctors might not be having so much success in treating it.
We just treat it very different. Like Todd said, medication is the standard of care in the United States for the therapy, and unfortunately it doesn't treat the problem. It just masks the symptoms while the patient gets worse.
Right.
And so we're actually trying to find the root causes. As we correct those things, then the patient begins to respond, and then we start to see real good success.
And so you feel great, Todd?
I feel a heck of a lot better than when I walked through his doors.
Now, I heard you saying earlier it doesn't go away completely, but it helps an awful lot.
That's the truth, yes. I'd say a 75% reduction in my pain.
I mean, that's remarkable, right?
That is remarkable. At first I didn't believe it could be done.
Yeah. And how long have y'all been at this again?
Since the end of October.
Yeah,
so it's a process, right?
Yes, it is.
Something that you want to work at and continue to navigate with the help of your doctor.
Yes.
Well, very good. Thank you so much for coming in. It's a really compelling story. If people are watching, they want to get some help, what can you do for them, doctor?
Well, right now, for Studio 4 viewers, if they would like to come in, if they know someone that has neuropathy or they themselves have it, they can call the office. We have a special evaluation set for the Studio 4 viewers. Normally, that evaluation runs about $285 for all the neurological tests and everything we do. If they want to call in the office, we'll schedule that. We'll do that for just $89 for anybody that calls that's watching Studio 4 today.
All right. Well, very good. And we'll put that information over on myhighplains.com for you. You can check out that phone number there on your screen right now, though. Thank you both for coming in. We appreciate it. Todd, I'm happy you're feeling better. That's great to see.
Me too.
Great to see. All right. We'll be right back after this, y'all.